Okay, hi everyone. Thank you so much today for joining. Today I will share my practicum experience with the First Nation Health Authority's Nutrition and Food Security team. My focus as a practicum student has been to develop a methodology for an environmental scan that weaves in Indigenous ways of knowing, centers and elevates First Nations voices, and reflects First Nations perspectives of health and wellness. In this presentation, I will share how a two-eyed seeing framework guided the methodology creation and grounded our team through reflection with considerations for relationality, relational accountability, and respect. My name is Sydney Verburg, and I am Cree, German, and Danish from my mom's side, and I carry Dutch ancestry from my dad. I am a daughter, sister, cousin, and granddaughter currently living and completing my practicum on the unceded ancestral lands and territories of the Musqueam, Squamish, and Tsleil-Waututh nations. I was born and grew up on Coast Salish territories, and I honor the Coast Salish lands that raised me and the people who have long stewarded these lands. I give gratitude to summer days that nourished my childhood with small handfuls of huckleberries, salmonberries, and thimbleberries. I give gratitude to the cedar trees that shaded playtime in the forest and to the coastline where the ocean mist and intertidal zones spark curiosity and a grounded presence. I hold deep gratitude for my teachers in this Master of Public Health practicum journey, including my supervisor, Kathleen Young, the FNHA Nutrition and Food Security team, including Nicole and Bianca, Dr. Jeff Masuda, my mom, dad, and brother, and the knowledge keepers, elders, and individuals who have generously shared their knowledge and stories along the way. The First Nations Health Authority supports over 200 First Nations communities in BC and receives direction from First Nations community leadership. The FNHA shares a vision for healthy, self-determining, and vibrant BC First Nations children, families, and communities. The FNHA's Nutrition and Food Security Program supports First Nations community-led food system initiatives through program service and delivery. In getting to know the team, I work to become familiar with core FNHA reports related to food systems, to ground myself in the work, and to help understand my role within the team. I also had the opportunity to be a listener and learner in food and nutrition-related meetings. I'm so grateful to have attended the FNHA Canning Champions workshop in Kamloops this past February, where we pressure canned chili, salmon, and carrots. This was an incredible opportunity to build stronger relationships with my team and community members, and it also provided an example of how FNHA's programs are grounded in work with community. In getting to know my team, I was also introduced to my main project, which I have called Conceptualizing an Environmental Scan Methodology for the Nutrition and Food Security Team's Strategic Planning. To learn more about the purpose of an environmental scan, I began a literature search and was introduced to a scoping review. Key takeaways from this scoping review to inform our methodology included prompting our team to develop core questions that guide the environmental scan, piloting data collection methods, and promoting transparency in the process. This scoping review was a great starting point to understand what environmental scans are and provided some guidance on the methods more generally. When looking for an environmental scan informed by an Indigenous approach, we found a scan by the Alberta First Nations Information Governance Centre. This environmental scan beautifully wove Indigenous knowledge and traditional ways of knowing into their approach. A section of this report speaks about respectful handling of data. It is shared that a body of knowledge is seen as a medicine bundle and thus demands the same level of respectful handling as a medicine bundle. Their approach led to a deeper inquiry of how to create a methodology grounded in values that have meaning for First Nations in BC. Mi'kmaq elder Albert Marshall describes the practice of two-eyed seeing as learning to see from one eye with the strengths of Indigenous knowledges and ways of knowing, and from the other eye with the strengths of mainstream knowledge and ways of knowing, and using these two eyes together for the benefit of all. Two-eyed seeing, which is used as an approach at the FNHA more broadly, feels like an appropriate framework to guide and conceptualize a methodology that honors the strengths of both Western and Indigenous knowledge systems. In learning from the work of Dr. Sean Wilson, Dr. Michael Hart, Dr. Lauren Tynan, Dr. Michelle Bishop, and Dr. Janet Smiley on Indigenous research and knowledge translation methodologies, we felt more grounded in our approach and thought about how to reflect values of relationality, relational accountability, and respect into our methodology. In these teachings and Indigenous worldviews, we are humbly reminded that food is relational and that there are inherent responsibilities to the land, the water, and to all life. Our environmental scan sources share knowledge through stories. It is therefore important to reflect on how storytelling is Indigenous research methodology. Our role in listening includes developing relationship and therefore also relational accountability. To ground the environmental scan methodology in relationality, relationality began with our own nutrition and food security team. To ground ourselves in the work and build relationship with one another, especially since I was new to the team, we met virtually weekly to get to know each other and to arrive at a shared understanding in the strategic direction work. We also gathered in person to spend time creating core questions to guide the work and discussed our values and considerations. By having meaningful conversations and relationships as a team where we aligned our purpose and values, we were able to build stronger relationships with the internal advisory, an advisory formed to guide the environmental scan and strategic direction work through clarity in our communication. Relationality in practice also included applying a health equity lens and self-reflective practice. Through this practice, we humbly acknowledged that we were missing voices from First Nations youth, 2S LGBTQIA+, and urban and away from home communities. These communities were not represented in the selection of environmental scan sources. To build relationality with these communities, we are reaching out to FNHA staff who are a part of or who work closely with these communities to ask for guidance on how to start building these relationships. The next two slides show reflections of how our team came together to build relationship, ground ourselves, and to come to a common understanding in our process. We are reminded by First Nations perspectives on food that food is tied to ancestral connections and inherent responsibilities to land and water. When we listen to stories, we connect with ancestral knowledge that can transform our understanding and guide us in our actions. What does this relationship and responsibility mean in practice for an environmental scan methodology? In learning from stories and recommendations through the environmental scan sources, we have the responsibility to use this knowledge to inform our understandings and decision-making and to act on them within our own programs and services. It is crucial that our methodology maintains a deep respect for the knowledge that is shared with us. We reflected on how to respect and honor knowledge in our data collection method. It was important for us to take extra time to be present in our methods to ensure that knowledge shared with us was kept in context. Methods to ensure that knowledge was kept contextual included creating an Excel sheet to keep information organized, ensuring themes emerged based on shared knowledge, piloting coding tables to ensure themes properly reflected knowledge, and the use of quotes over paraphrasing. Our own biases and misunderstandings of knowledge may show up if we paraphrase more often than quote. This learning comes from Kwastanahan Williams and Fiona Devereaux, authors on the FNHA Common Language Report, who reflected authentic voices through the report with quotes and words directly from community members. The learnings in my practicum and methodological reflection have revealed challenges and considerations. This process makes us wonder if there's a more culturally responsive framework from BC First Nations, as the Two I'd Seen framework is from Mi'kmaq Elder Albert Marshall of the Eskasoni First Nation in Eastern Canada. The FNHA supports 5 regions, sub-regional groups, and over 200 communities with diverse food system relationships and unique language groups and cultures. In recognizing the diversity across the province, I am curious if regional FNHA teams have used any nation-specific frameworks in their planning processes to provide culturally relevant and safe care to community in the regions. Through applying a health equity lens in our methodology, we also learned that there are knowledge gaps in reporting specific recommendations from First Nations youth, 2S LGBTQIA+, and urban and away from home communities. We had challenges finding sources that informed how the provincial health system and ministries can best support these communities with food security and nutrition work, revealing a gap in the published literature and the structural exclusion of these communities. As we work with other FNHE staff to build a relationship with these communities, we look forward to learning how we can best support them in our work. Thank you all for listening today. And a special shout out to my team for making it, my mom and some friends who joined the call as well.